background, I'm coming from a health background, so keep this in mind when I'll talk about this. It's going to be quite a bit of health. Yesterday, Maria did a great presentation. In particular, what can be done in the cities. She's got power. I'm just doing research and I come up with fancy things that may not always be applicable or can be implemented, but give some good ideas. I think my presentation is also complementary to what Maria said or what Maria didn't say yesterday for some of the things that I would like to bring in there. So where do I come from? At the moment, I think what we're having is an enormous climate crisis that's affecting society. It's affecting us, whatever we do, affecting our health. But unfortunately, I think we still keep doing what we've been doing for a long time. And we don't take the appropriate actions, to make a change. This is not an AI picture. This is a real picture taken already about 10 years ago, where people are just, doing their things, playing golf, while at the background, the forest is going up in fire. So also for this, we know, that we need to take climate action, and cities are at the forefront of climate action. And I will talk a little bit about, what are some of the possible actions that we could take to address the climate crisis, or what we should take, I think. Normally, we've seen them more as kind of urban and transport planning changes to improve things, but I think they're also part of climate action. We know it's quite serious. We see every year, the indicators that things are getting worse. I mean, this is some pictures from last year, some flooding in Austria, wildfires in Portugal, heat wave in the south, what we had, and also the water shortage, what we had. Normally, these are the reservoirs in Catalonia. Normally, the church, you won't see, it's underwater, and the water levels went so low that we actually could see the church. A very dramatic event happened last year also in Valencia, where at once there was a lot of rain. Many people died. Many cars were destroyed. I mean, I think there were around 60,000 cars were destroyed. I mean, people couldn't use anymore because of the flooding. I mean, this also was kind of an event because of the caused by the warming of the Mediterranean Sea. Where there's more energy, generates more rain inland, and then it all comes down. So what we see because of the climate change, climate crisis, heat waves, also sometimes more extreme cold spells, flooding, droughts, all these kind of events are becoming more extreme, actually, and, where we're also being affected, particularly in our cities. We know that these kind of events are related to premature mortality, also particular poor mental health, people suffering, climate anxiety, what you have, and other disorders, I think, would come in. The last few years, we see an excess of mortality within Europe. In 2022, it's a number often mentioned. It's one of my colleagues who estimated that there are more than 60,000 premature deaths in Europe because of heat waves. So you can see it's got a quite large impact. And then only talking about mortality, not talking about disease. That unfortunately, we're going the wrong direction still. We're still warming up in our cities. I mean, there's more heat stress in our cities. At the same time, we see less green space. I mean, green space can help mitigate and adapt to climate change. Unfortunately, that's going down. I mean, our city is becoming more concrete. I mean, what actually makes it much worse. So it's in a way, it's not a very good place to be, according to these projections. And that's why I said we should take actions. We should take action, climate action, to counteract this. But first of all, we need to understand that there is a clear linkage between how you design a city, how you get around, what kind of, how this leads to environmental exposures and lifestyle factors, and then to disease and premature mortality. You know, what we've seen so far is that our cities are quite car dominated. We put in a lot of infrastructure to get cars, or allow cars to come into the city, make more public space available to the cars to have city. So, you know, what happens is that more people go and use the car. If there is more space, you know, induced demand, you go get more car use. That leads to more air pollution. It leads to more traffic noise. It also leads to urban heat island effects. So the temperature is higher. I mean, because of if you have car infrastructure, asphalt, in particular in the summer, it absorbs the heat and then it radiates. Typically, city centers, like here in Barcelona, it's 3, 4, 5 degrees hotter than surrounding areas. Also, it leads to more stress. We know that car drivers have more stress. They tend to also have less social contacts. And in particular, they have less physical activity. And sufficient physical activity is very important for health. All these factors are related to diseases. You know, when you look and think about cardiovascular disease, respiratory disease, what we see also, diseases like dementia coming up, mental health problems, and then this can lead to premature death. On the other side, you know, if you design and invest in, say, cycling infrastructure, you know, if you put more cycling infrastructure in, you get more people to cycle. When people are cycling, there will be less air pollution, less noise. Cycling takes up less space, so less urban heat island effects. Also, cycling reduces stress, it increases social contacts, and also in particular, it increases physical activity. If you can build in, you know, cycling to work every day, you can probably reach the guidelines that the World Health Organization sets for people to live a healthy life. World Health Organization says you need at least half an hour of moderate or vigorous physical activity per day to live a healthy life. It doesn't sound a lot, but most people actually don't achieve that level of physical activity. So with this cycling, you actually can reduce morbidity, disease, and you also can reduce premature mortality. We're working with a large database of nearly 1,000 cities, and we're trying to do some health impact assessment, trying to estimate what is the burden of disease, the burden of mortality, related to factors, in particular environmental factors, in those 1,000 cities. Sorry for you, some of you were very Europe-centric. This is Europe. If you're not from Europe, I mean, unfortunately, you're not down here. But we cover most of the large cities in Europe. Where we look. We use a method, health impact assessment, where we look what are the levels of air pollution, and then based on exposure response relationship from the literature, we can estimate how many people die or how many people get disease because of the exposures we're interested in. The data that are presented at the moment are a bit older, they're 2015. We're doing at the moment a project to update this, but I think quite a lot of what you see is still valid at the moment. So what we found at that time, for 2015, that there are more than 200,000 deaths in those 1,000 cities related to high levels of air pollution. Most people in the cities are above levels that the World Health Organization recommends for air pollution. The World Health Organization says that nitrogen dioxide levels shouldn't be above 10 microgram per meter cube, and particulate matter levels, PM2.5, shouldn't be above 5 microgram per meter cube. Most cities are still above this, and therefore also you see health effects, including premature mortality, so a fairly large number. Also, we found in those 1,000 cities that 60% of people don't live within 300 meters of a green space of at least 1 hectare. This is also what the World Health Organization recommends. and that this is related to up to 43,000 premature deaths each year because of the lack of green space. Green space is also essential for us, for our health. And we know from many studies now that there's a direct relationship with the amount of green space in your area where you live and the level of premature mortality. Furthermore, we see that 60 million people are exposed to noise levels that are harmful for health. Cities tend to be noisy. Barcelona is a compact city. It's quite noisy. Although I spoke to yesterday from someone from India, I don't know where she is. She said it's a lovely, quiet city. Well, it's relative, everything, I guess. And also we found that there are more than 20,000 deaths that year because of the increased heat in the cities. So what you can see in those 1,000 cities, there's quite a big burden of disease and mortality, in particular mortality here. It's kind of the peak of the pyramid mortality. Under that you find disease. So that we actually should reduce. You know, this is kind of unacceptable, what you actually see. If you look at air pollution, also we had a ranking. If you go to the website, if you live in a European city, if you go to ISGlobalranking.org, you can see for your city what are the air pollution levels, how you ranked it, this kind of things. But you can see that for PM 2.5 particulate matter, that's less than 2.5 micrometers, we have cities in the north of Italy, in the Po Valley, cities in Czech Republic and Poland that have high levels. Partly it's related to in the Po Valley because of the climatic conditions, industry and whatever what they have. Czech Republic and Poland was because of coal burning. But if you look at nitrogen dioxide exposure, what's related to particular car use, traffic in cities, you know, you see other cities like Madrid and here Barcelona. Barcelona 6 in the number of mortality related to nitrogen dioxide out of the 1,000 cities. We have a problem here. I mean, Barcelona is quite compact, many cars, what is creating quite a bit of air pollution. Maria talked about yesterday that a compact city is what she would like. I mean, me too. I love the kind of compact city what we have, like Barcelona. But we still have problems with the compact city. This is a study what we did also for the 1,000 cities. We did some unsupervised cluster analysis to look to see what kind of type of cities you could find in Europe. And we found 4 types of cities. On the left side, the compact high-density city, typically like Barcelona, for example. On the right side, the green low-density city. Lots of green space, but it's more spread out. And also when you look at terms of size, population, you can see some real differences. Now here what you can see is some of the indicators related to the city configuration. And of course, I mean, the compact city on this side is great in terms of if you look at CO2 emissions per capita. The compact city, people don't have to travel so much, everything is closer and whatever. So you find a lower CO2 emission per person than, say, for example, a low-density city, what is much more spread out. The other 2 city types are in between these 2, so I'll focus on the extremes. However, at the same time, though, what you find in a compact city is that the traffic density per square kilometer is much higher than in a low-density green city. You know, it's about 2-3-fold difference in the traffic density. So you get a lot of traffic. What does that mean? Is also that your nitrogen dioxide levels, what comes from traffic, is much higher in the compact city than, say, in the green low-density city. Also, what we see in the compact city is that the heat island effect, temperatures, are higher in the compact city than in the green low-density city. Also, what we have seen in the compact city, there's less green space. You can see here there's much more green space in. And what this means, or what it led to, is actually that also the mortality rate per 100,000 in a compact city is much higher than in a green low-density city. So in the compact city, we've got a mortality rate of 1,124 per 100,000 people, while here we've got 1,003 per 100,000 people. So there's kind of a deficit, what you see a difference. Actually, this difference in mortality rate, you could to a large extent explain by the difference in the levels of air pollution. If there wouldn't be any air pollution in the compact high-density cities, if there would be a bit more green space there, if there would be less heat island effects, the mortality rate would be also similar or even lower than in a green low-density city. As what I said, Barcelona is one of those cities, compact, high-density city, that has a problem. I mean, this is one of the main streets in the city, Carré Aragon. It's in the middle. But if you look at this, this looks almost like a highway right in the middle. 5 lanes of cars going straight through the city. I don't know, the people that going tomorrow, on Saturday to the superblocks, I think go to Concel de Seine. This street is one street over from the superblock Concel de Seine. So you can make the comparison actually what it looks like that. But this seems to me a crazy situation. And of course, people in this neighborhood, they're complaining. There's too much traffic. There's a lot of air pollution. We estimated that in Barcelona, each year there are almost 3,000 premature deaths because of air pollution levels, because of noise, because of heat island effects, because of the lack of green space, and also because of the lack of physical activity. This is about 20% of all mortality in Barcelona is premature because of those factors. For example, in air pollution, there are around, depending how you count, between around 1,000 deaths each year because of the air pollution levels. This certainly is quite unacceptable, I believe, and that's why we should be lowering air pollution quite substantially. We can't keep our heads in the sand. We need to look around, we need to take action. And it is not easy, as Maria was saying yesterday. And as many of you know as well. How do you change people's behavior? What can you do? I believe we should be looking at greening. It's very difficult. Maria pointed out it's got to do with water. I mean, we don't have much water here, but that's why we need to have better water management. But we know that green space is very good, or actually essential, I would say, for people's health. We know now it reduces cardiovascular disease and cancer. It reduces air pollution and noise at the same time. It promotes physical activity. And in particular, also what we see, it improves people's mental health. Nowadays, a lot of people have problems with mental health. It's amazing how high the numbers are, and I'll show a bit later. And there's something also particular what we see, and perhaps it's not unlogic in a way, because imagine we've been for tens of thousands of years running out in the jungle and on the savannas or whatever. So our brain is used to green space, and then once you come into a city where everything is concrete, that's not very good for the brain. Also, we know for children it improves memory and attention, and what's important as well, it decreases heat island effects. So what we see is what I said, in the city is normally a bit warmer in the city center than surrounding. It also can reduce. And also we know it reduces premature mortality. Now when you look at this, you think, this is beautiful. I could easily be there, not be rather there than sitting here in the room. But And this is beautiful, but of course, you can't put parks so easily like this in a city. I mean, there need to be different solutions. I mean, I think cities that have this type of park, they're very lucky. I don't know where this is. It looks something like London or Melbourne or whatever would have these nice parks. But so we need to look at other things. And this is, for example, what we're trying to achieve, or what the ideas were, is the superblock. The superblock was a concept that was originally Salvador Rueda came up with that when he was working at the BGN Ecologia. The idea was to cut off 4 junctions in a grid. As you know, most of Barcelona has a grid system. Cars going up and down, left or right, one way. Very efficient to get the cars through. Whoa, let's go faster. Yo, one road. Yo, let's go to. The idea of a superblock is actually cut off the junction, only allow active transport, walking and cycling, make a nicer environment, and also put in more green space. So this is, I think it's a wonderful idea. The idea was to create 503 superblocks in Barcelona. Now, we didn't get far. I think so far, depending how you count, there are 3 of them. This is one of them. I don't know if you're going to visit on Saturday, Sant Antoni. If it's not planned, I mean, definitely go. Sant Antoni is an area where there was a market, and around it, they created what we call a superblock. It's not the full superblock, but it looks the closest what you get. So on the left, you see what it was before, normal road, and then on the right, with this nowadays, many more kids, active transportation, more green space for what it is. So as what I said, the original idea was to create 503 superblocks, and we did a health impact assessment to show what would be the health benefits if we create or implement all the superblocks around Barcelona. And what we found was that you could prevent almost 700 premature deaths each year if you would implement the superblocks. The largest number in this case was because of the reduction in air pollution, what it's caused, almost 300 deaths, followed by the reduction in noise, also you can save lives. Then because of the heat island effects, then because of the increase in green space, and then also a bit of because of the increase in physical activity. Now, the amount of physical activity is actually underestimated here because we didn't have any numbers to see what would be the change in physical activity. We just assumed if there would be some changes in car use, but we expected, I think 20% reduction in car use, that would lead to a bit more physical activity. But you could imagine if you go also to these places that people walk around more, are more likely to go out, so get more physical activity. So there may be additional benefits there. But so, changing the urban design of a city actually can really improve health based on this kind of example. Now, unfortunately, actually, this idea didn't make it. We only had a few superblocks. And then what I came was what I call the superblock light. What is the ISGlobal is the Green Corridors plan, ISGlobal. There the idea was to, in the city center, the example area, this is right in the city to actually pedestrianize some streets and make them also greener. This is probably the one you're going to see, Concel de Seine. This runs straight through it here. And then there were also some other streets proposed. Now we had a change of mayor a year ago, 2 years ago now. And just before the mayor changed, they managed to convert 4 streets into a green street or a green corridor. So there's Concel de Seine, Calle Girona, Roquefort, and Comte Borel. Then the new mayor came and said, no, forget about it. We're not going to do anything. And so only part of this plan was actually achieved. So 1 out of 3 streets were pedestrianized. what is, I think, a real shame, because if you go there, I mean, then it's quite different. Here, by the way, this is Cara Arago. That's where I showed the picture, the kind of motorway running through the street. And if you go one block further over, this street also is Concel de Seine, was a busy car street before. So here you see some of the changes before and after. I think there's Roquefort. These are artist impressions, by the way, not the real pictures. But we did a health impact assessment as well. What if you would introduce, the green corridors in all of them? We saw that, or we expected, if you introduce them, because of the green space that was introduced, this was only looking at green space, we would get a reduction between 8 and 14% in a number of mental health indicators. So the reporting of self-perceived mental health, 14% reduction, going down to visiting mental health professions or the use of antidepressants, the use of tranquilizers, a reduction of 8 to 10% for those. This would be a saving of around 45 million euros per year, just on mental health, related to this mental health. Well, of course, there are many more benefits. If you look at the actual numbers, I mean, then, you're talking about tens of thousands of cases of poor mental health that you actually could prevent if you introduce the green corridors in Barcelona. Partly is because, there are many people that have mental health problems. So with introducing green space, you could prevent quite a few of them. The other thing was what I mentioned is the urban heat island effect. Typically what we see is that the city centers are hotter than surrounding areas. There's more asphalt, there are more concrete buildings, absorbs a lot of heat during the day, releases at night. Then also you have the cars going around, add another 1 degree of temperature to the city centers. And this also makes, the city center often quite unpleasant. And it's better to be outside in the greener areas. We did a study of around 100 cities, including Barcelona, to look at this. And we found that 4% of summer mortality in those 100 cities was related to the urban heat island effect. So 4 out of 100 deaths that happened during the summer months was because of the extra heat that you have in the city centers in cities. We also found that if you could increase tree cover from the current around 15% in the city to 30% of tree cover, you could reduce the temperature by about 1.3 degrees. It doesn't seem that much, but still you could prevent 1/3 of the urban heat island related deaths in the cities because of the greening of the city. So again, quite a considerable number, if you could green actually the city. It's not always easy. Greening cities, it takes a long time. But this is one rule that was recently introduced by Professor Cecil Konijnendijk when he was living in Barcelona, where he proposed this green space rule. I don't know how many people of you have heard it. The idea was that he said that every citizen in the city should be able to see 3 trees from the window, from him or her window, live in an area with 30% tree cover, and live within 300 meters of a major green space of a park of at least 1 hectare. So that's where the 30-300 rule comes from. And I must say that quite a few cities have starting to make plans to try to achieve this rule. Now, of course, this is not easy. We looked in Barcelona. We did a little study to see how many people achieved this rule at the moment. And we found that only 6% of people living in Barcelona actually achieved this 300 green space rule. So that's a very small percentage. We also found that those that achieved it had much better mental health than the people that didn't achieve it. So actually achieving this, you really can improve mental health. Although, as what I said, it's quite difficult as well to achieve this. And to make the whole city like this. Unfortunately, I think, and I heard Maria talking yesterday as well when I was asking her the question about air pollution. We have technological, advancement that will solve the problem of air pollution. Probably she was partly referring to the electric car. I mean, we all, are given the electric car as kind of the solution to the current climate crisis, to our current problems with air pollution in cities, to noise and this kind of things. But for me, the electric car is not the solution, at least not in cities. I mean, outside cities, it's a different, but in cities, because we still have the issue that an electric car is still a car. It takes up a lot of public space. In Barcelona, 60% of public space, our streets and whatever, are actually taking up for car infrastructure, while only a small percentage, 10-20% of trips are actually by car. So it takes up a lot of space. Also, if you sit in a car, it doesn't increase your physical activity. I mean, in a normal car, internal combustion car, or an electric car, still you don't get physical activity. So that doesn't help. Of course, your nitrogen dioxide levels coming from the tailpipe goes down because it's electric. But we still have particulate pollution coming from tire wear, from brake wear, and this kind of things coming up. So for me, it's not the solution for this. We need to think about other solutions. And you love the bicycle. So here is your bicycle. And I'm perhaps a bit biased, I must say I'm coming from Holland. I could cycle before I actually could walk. But 50% of car trips in general, what are taken are less than 5 kilometers. This could be easily replaced by cycling if there would be good cycling infrastructure available. Often this is not the case. Also, having a car is actually quite expensive. I mean, some work by Stefan Gosling over the last few years showed that people spend about 20-30% of their income in running a car. It's not only buying the car, then it's also getting the insurance, the petrol, whatever you need to do to keep a car going. I mean, no surprise that people don't have any money because they spend it all on the car. In that way, cycling could be a solution. Of course, it's not so easy in Barcelona. It's quite hot at the moment, but cycling has a lot of benefits. I mean, that it reduces premature mortality. We know it's more physical activity, so it's better for your health. Most people don't have enough time to go to the gym to get physical activity. So if you cycle to work, you combine, commuting with going to the gym. You have less air pollution, less noise, zero CO2 emissions, takes up less public space. Cyclists are normally happier. And also what we know, the risk of the benefits of physical activity well outweigh any risk of inhaling more air pollution or accidents. Most people say, I'm not going to cycle because the risk of accidents are so high. Well, your benefits for physical activity are still way higher. This is Utrecht. I think it's one of these, what I call progressive cities that have changed a lot. I mean, I went to Utrecht 30, 40 years ago, was still car dominated. If you go now, it's cycling dominated. It's a bit frightening as a pedestrian, I must say, when you go there and walk around. I mean, all this crazy cyclists going past you, but it's beautiful to see. I mean, and the city really made an effort. They have had a policy over the last 10, 20 years to encourage cycling. So, and it's the kind of time period you actually need for this. We did a study in 167 cities around Europe where we looked at the availability of cycling infrastructure per 100,000 people and the percentage mode share of cycling. So how many people, how many trips out of, are being because of cycling. So the cycling mode share goes up to about 25% there. I mean, 25, what we see. So what we found was there was almost a direct relationship with the amount of cycling infrastructure available and the percentage mode share of cycling. up to about 25%. So 1 out of 4 trips by cycling. And then after that, it broke down the relationship because there are other factors that are important, probably cultural factors. But for me, it shows that, you know, safe cycling infrastructure is actually essential to get people cycling. You know, build infrastructure and people will cycle. That's kind of my notice. Of course, it may be a bit of a chicken and egg question as well. Do the cyclists first, you know, come first and then the cycling infrastructure, or the other way around? I think it's first cycling infrastructure and then you get the cyclist. Also, we estimated that in this 167 cities, if we brought up the cycling infrastructure, the cycling mode share rate up to 25%, we could prevent almost just over 10,000 premature deaths each year because of the increase in physical activity. So it's what you can see, get people to cycle, and you know, it's much healthier for people. Now, the COVID period, the pandemic, was not a pleasant period, but it was a good period also for doing some, you know, quasi-experimental, natural studies. I mean, this comes back to the question, you know, what comes first, the cyclist or the cycling infrastructure? And these people, Kraus and Koch, I mean, they did a nice experiment where they looked at a number of cities. Some cities introduced more cycling infrastructure during the COVID to get, you know, people out of the car and cycling a little bit, and others were not. And what they found was actually the cities that they where they introduced the cycling infrastructure, this is what pop-up cycling infrastructure, because it was normally not permanent, they actually increased their cycling mode share quite considerable, I mean up to 10% or so, while in the cities where there were no changes, there was no increase. That. Again, here it showed that, you know, you need the safe cycling infrastructure to get people to cycle. I believe, and I'm perhaps a bit biased, but that we should put health and health well-being at the center of urban planning. Yesterday, Maria, I didn't talk much about health, so I was a bit upset listening to her. I mean, so I believe we should put that, you know, and then things come together. I mean, that it should improve. But I think also what we have at the moment is what we're missing is a shared vision of a better city. You know, why we should do this and how this leads to better health. I mean, we forget about this kind of things, that ultimately we should, you know, work on reducing the climate crisis, the problems, and also improving health. Most of these measures, what we see, I think I call them climate action, and we urgently need this. Unfortunately, though, what we see is that if you introduce things like low emission zones, whether another one, or you introduce more cycling lanes, people see it often kind of a restriction that is proposed on them, in particular car users. You know, that's kind of, or the 50-minute city or the low traffic neighborhoods. You get a lot of people going up, no, I can't drive anymore. Because, you know, what the rationale behind it is actually not well explained. You know, why we're doing this, how it can improve people's health. I mean, how it becomes, you know, how it makes cities more livable as well. So we should work on this, you know, co-create, engage people to create this vision of what is a healthy and livable city. I'm coming from public health. I do health. I can't make any changes. Here, some of you probably maybe urban planners, transport planners, others engaged in the cities that actually can make changes. So we need to work together. I mean, we need to have a multi-sectoral approach, systemic approach, bring other people together. I mean, that, you know, think about different sectors that are actually involved. I mean, and unfortunately, often it's not what we see. In cities, we have silos. Here, urban planning, transport, environment, climate, health, housing. I mean, it's crazy, and these people don't talk to each other. I mean, that you get this all specialized. I mean, they all have their departments, work on their budgets, and then, you know, but there is no shared overall vision where we need to go. I mean, that, and then, you know, you think about education. too many kids are going to school by car. Why should they go to school by car? Because it's not safe. No, it's not safe because there are too many cars. So we should, think about this a little bit more, what we actually want to achieve. Unfortunately, in the urban planning process, often there's not much thought about health. I mean, a few years ago, the Generalitat, the regional government, they asked us to come up, we don't know what means for health, what we should do. And so they said, when we do this planning, they have to tick a lot of boxes about what places should look like, what houses should look like, but nothing that may be related to health. Can you come up with some simple indicators, some tick boxes that if we're doing a new planning project, that we can go through this? So we came up with some, what I think, simple things. What we know from the literature, what are related to health, including land use mix, that people live close to destinations, shops and living, work all close together, walking, density issues. What is the ideal density? Having cycling lanes, having public transport stops nearby, multimodality, green space, and then an integration of all that. So these are fairly simple, and perhaps to many of you these are quite familiar things, but not always to the people that actually make the decisions for this. Then based on this, we thought, let's look at this, what's happening in the 1,000 cities. How are they, what do they look like at the moment? Can we somehow integrate them into some kind of tool, and can we do some assessment of what are the cities like at the moment? So last month we published this paper. It's called, we developed a new index, the HUDI, the Healthy Urban Design Index. And so we explain in the paper, what is a HUDI, how it's implemented, and what it stands for. So this gives you some idea how well a city is doing based on some of these indicators. It's not perfect at the moment. We just use data that's routinely available, that you can get from different databases. And we put it also for different types of cities. So we did it for large metropolitan area like Barcelona, large cities, small cities, and smaller, because the issues are quite different. But you can go to the website, ISGlobal ranking HUDI, and find there what your city is like. I just picked out here Barcelona. Here you see some of the indicators, what actually are in Barcelona, how well it's achieving. It's on a scale from 0 to 10. If you're 10, you do very well. If you're 1 or 0, you don't do very well. And so when you look actually at Barcelona, what it's doing well is in the dwelling density. It's a very compact city, a lot of mid-rise development, not very high development, but we always say 5, 6 is the highest you should build in a way, doing very well. But then also the opportunity to walk does very well, because, it's so easy to walk everywhere, or distances are not very large. But then there are problems with permeability. The water can't go away. It's all constructed surfaces. The opportunity to cycle is not great. There's more cycling lanes at the moment, but still not great and not connected. Air quality is still poor compared to other cities, not as much green space, still have problems with urban heat island effects. So we're having quite a few problems. But the city could see, where could we improve on this? And we did this for the nearly 1,000 cities. So you can see if you're living in one of those cities, what could you do? How could you improve? What may be helpful? Changes are not easy to make, but there are some examples where it happened. Probably you're familiar with them. Think about Salle. Before they had a big motorway running through the city, they said, oh, we're going to get rid of it. And what do they have now? A nice waterway with a small road next to it, more green space. Lovely. Düsseldorf, a big example as well. Even the car-crazy Germans, they sometimes think it's better to have a bit more green and blue. I think it's good to see it in many cities. We have this kind of development. Also here in Barcelona, not so far from here, we used to have this crazy roundabout, beautiful kind of concrete structure, cars coming into Barcelona, nicely distributed, going around, some park in the middle. I'm not sure anyone used it. But this was actually taken down. That's it. Don't know what I did. A tunnel built underground, and now it's a park. I hope you get to visit as well. I don't know if it's built in. Parc de Glorias, wonderful design museum next door. What's a much nicer area than the roundabout. This you've seen, the superblock before and after. Also, we know, for example, in Paris, big changes going on. I think that's leading. This is coming from the cycling professor. I don't know how many of you follow the cycling professor, where they always show really nice changes before and after on his Instagram and also Twitter, I think, what he's using. This is another nice example how changes actually can be made. This is in Liverpool. There was an old hospital. They needed to tear it down and build a new hospital. They asked the children, what would you like? They had some engagement. The children said, we want to have a bit more green space. So what they did was actually build the new hospital underground on the old park and put green space on top. And the old hospital became green space. So you could create quite a bit of green space in that way. Then this is one of my kind of favorite neighborhoods. I think favorite to many people. This is Vauban in Freiburg. It's a car-free neighborhood, sustainable housing and green space. The problem there, though, it's become too popular and it's very expensive to live there. Everyone would like to live there. As soon as you go there and visit, you think, I don't want to leave anymore. I'm going to live here, but fortunately not so possible. And, this is how we would like to see people going to work, cycling, roller skating, walking to go there. Also, one of my favorite streets in a way is Rambla de Poblenou in Poblenou. If you visit Parc de Glorias, walk down on the Rambla de Poblenou, a kind of also an area, mixed use. People live there, people shop there, people walk there, beach is close, it's a lovely area. Unfortunately, becoming also a bit popular is taking over that. Anyway, if you want to read a bit more about this, I published an article earlier this year, or was last year, in the Lancet journal, talking about all this kind of issues around climate crisis, cities, health. If you go to my LinkedIn page, you can download it as well. I think probably the easiest way to go. So I'm always talking. This is actually my research group, and they do all the work, thanks to them. And when we get a paper out, we go for lunch and celebrate. So that's why they're all looking very happy. That if you want to know more a bit about the work we're doing, we're having a large project, a European project called UBD Policy. There's a website here, ubdpolicy.eu, where there are some more examples of what we're doing in the 1,000 cities. So many thanks for your attention, and happy to take any questions if you have any questions.